Dr. Glynn, you mentioned the need for a proportional and a proportionate response. Professor Nolan, you also mentioned the need for proportionality. As Kildare, Lough, Laois and Offaly had been locked down, we heard from Meat Industry Ireland and the HSA, and they confirmed that 39 meat plants had been inspected, of which 30 inspections were pre-announced. The day after it was announced that we weren't in a position as a state to move to stage 4, you, Dr. Glynn, pointed out that there had been, I think, 47 cases in meat plants and 4 clusters. That was the most recent of a large number of clusters. Yet in one, we've had no clusters in any hospitality business, yet in one weekend there were 6,000 inspections of licensed premises, of which less than 0.5% showed any lack of compliance. Are you happy that that aspect of the state's response was proportionate to the risk?
From my perspective, we need to decrease congregation across settings. We need to decrease risk across settings. We need...
No, my question is I've heard all of that, and I completely, I mean, everybody, I think, at least I hope everybody recognises that we need to wash our hands, we need to avoid congregated settings, we need to avoid places that are busy. But I'm asking, is 39 visits to meat plants where there have been cluster after cluster after cluster in this state and many other states across the world, is that proportionate where there were 6,000 visits to licensed premises in one weekend and there's been no cluster in any of those? There have been, mind you, 10 clusters in the United Kingdom, or 10 outbreaks in the United Kingdom among the 7,000 licensed premises there, all of which are open, whereas ours are closed. I'm asking, is that proportionate?
So my answer to that is that we need to do everything we can across all sectors to decrease further cases in clusters, whether that's in restaurants and bars or whether that's in meat processing facilities. Enforcement and visitation is one element of that, but it's just one element. Ultimately, it comes back to human behaviour.
You're happy that it's proportionate. I'll move on to the next question. Is it not the case that our health system is quite bad, but if we continue on the road we're on economically, we won't be able to fund the health system that we used to have, much less the health system that we so desperately need? Now, that may not be a consideration for you, but it has to be a consideration. And I'm not saying it's not a consideration for you, but you're a health official and you're doing a very difficult job, and I acknowledge that. But your primary responsibility is solely for health. But we have to fund, as Paul Reid acknowledged earlier in the week, we have to be able to fund our health system too.
Absolutely, and I thank you for acknowledging that. What I would say is that yes, health, of course, is my priority, but I also fully recognise that public health and our public health system is absolutely contingent on a functioning economy. And if the economy is unduly affected by this, it will affect our health system. So that does come into our considerations. But that's precisely why, for example, we moved so quickly in relation to Kildare, Laois and Offaly. It's why I'm so concerned about cases at the moment. We don't have magic bullets in relation to this disease, and we are entirely reliant on solidarity and cooperation and individual and collective behaviours to keep this under control. Otherwise, we won't have a choice but to go backwards with stronger measures. And look, I am the last person who wants to have to recommend measures that have a further impact on the economy, that have a further impact on people's lives, which is why I'm asking all parts of society today to please double down again on their behaviours and on their messages to their families, to their members in their organisation, to anyone they come in contact with. Let's all be upfront about our role in this, and let's ask our friends and families to do their bit, because it's only by being vocal and being honest and saying, look, please wash your hands, please do the right thing, all of us together, that we will keep this under control. If we don't, it will have impacts, unfortunately, for the economy, whether we like it or not.
I just have two very brief questions. The expert advisory group on nursing homes that recently report to the department. Are there any members of that being appointed to NEFID? Are there any, given anecdotally, I have to say very regrettably, I'm hearing about a lot more suicides than I have done for a considerable period of time, and that's in the middle of summer before we head into a long, dark winter. Are there any mental health representatives of psychiatry or other mental health representatives being appointed to NEFID, which is essentially the decision-making body for our state, because it doesn't appear largely elected representatives are following the health advice?
So just to say that NEFID had undertaken a review of its membership and its functions over the past number of weeks. But as you know, the government intends to publish a future framework over the next very short while, and NEFID's membership. So basically, we had intended to review and update NEFID's membership, but I think at this point, and given that the framework is due to be published very soon over the next fortnight, it's prudent to wait, review that framework, review NEFID's role within that framework, and to ensure that our membership is appropriate to our role following on from the publication of that framework.
And lastly, am I correct in saying that many countries, including Ireland, have witnessed an increase in detected cases, but that hasn't been accompanied, thankfully, by an increase in hospitalisations and an increase in ICU admissions and an increase in deaths? Could I just ask, what is the increase? How much have we increased our ICU capacity since the initial lockdown in March? That's the first question. And secondly, that seems to be an international trend, but from what I'm understanding, you say that the only reason for that is because elderly people haven't been contracting it up to now, and once they do, that we will see an increase. Am I correct in summarising your position?
So I'll hand over to Professor Nolan, but just to say that we have no reason, no evidence base to believe that anything other than what I've described will happen if we allow this disease to take hold and to spread amongst those who are older and medically vulnerable.